I'm going to stand here, by the way, because I might think life's a lot easier when I've got a speech to read, if I'm actually got somewhere to put the bits of paper. So my other fellow panellists, I think, may be well staying where they are, but I need to be here. I just wanted to kind of caveat before I start. A very good friend of mine, Ethan Nadelman, at a meeting yesterday, made a very good point. And what he said was that everybody involved in this public health space is invested in tobacco control. So we all kind of want the same things. We all want to deal with the death and disease caused by the global epidemic of smoking. So when I refer to the international tobacco control community or the international tobacco establishment, what I'm specifically referring to are those well-placed and well-funded elements who are implacably opposed to tobacco harm reduction and the use of safer products and see no role for them in being part of this solution. So that's just a little caveat. So, in 1997, the Global Burden of Disease Report estimated that around 3 million people were dying annually from smoking use and projected a sharp increase in the years to come. And sadly, that report was proved correct. 5 million by 2002, at which point the WHO projected deaths at around 8 million by 2030. But we're already there. In 2001, Professor Richard Pato, who's a leading expert on tobacco mortality, estimated 1 billion lives by 2100. And that forecast remains unchanged. And that same year, the US Institute of Medicine published Clearing the Smoke, the scientific base for tobacco harm reduction. And one of its main conclusions back then was that many of the diseases attributable to tobacco mortality could be reduced by reducing exposure to tobacco intoxicants. Now, that report and all those calculations for deaths preceded enactment of the Framework Convention on Tobacco Control in 2005 and the entirely separate launch of the WHO Empower monitoring program in 2006. That's during that same year, and roughly in that same period, the first e-cigarettes arrived in the USA and in Europe and ultimately fulfilled the promise of what was described in Clearing the Smoke. So what's actually been achieved since 2005, 2006? Even before this time, many high-income countries were seeing falling prevalence of smoking anyway, due to an emphasis on healthier lifestyles, mainly among the more well-off in society. But even now, in those countries, those higher-income countries, prevalence graphs are flattening out. In lower and middle-income countries, population growth could result in an underestimate of future global smoking-related mortality. So I think it's fair to say that whatever tobacco controls are in place across the world, they are simply not enough to put a significant dent in some of these really awful predictions. So how has the international tobacco control establishment reacted to what are manifest failing policies? In the interest of global public health, a sensible and pragmatic response would be to take seriously the opportunities offered by the advent of safer nicotine products, which now a welter of independent evidence shows they are substantially safer than smoking. They help current smokers both switch away from smoking and offer an off-ramp to cessation should they choose, while at the same time offering little risk to bystanders. So if you actually want to help smokers, that's what you do. Especially as the WHO admits that the weakest bit of the whole Empower program, is the O bit, which is offering help to smokers. where they admit that 70% of whom globally have no access to helping services. The truth is, to be honest, there is little evidence of concern for the plight of current smokers and the impact that smoking has on families and many marginalised and disadvantaged communities, including Indigenous groups and those with substance or mental health problems, whose smoking prevalence is sky high compared to many national norms. Buried in reports covering non-communicable diseases and sustainable growth development goals, there is a recognition of failing tobacco control policies. But for public and political consumption, the WHO choose to trumpet that Empower reveals 5.3 billion people protected or covered by tobacco control policies. So the question is how come we still have 8 million people dying every year from tobacco-related diseases? And an unchanged forecast going back to 2001. As far as I'm concerned, Empower is nothing more than a tick box exercise, focused on passing laws which in many countries are unenforceable, either through a lack of resources or a lack of sustained political will. Far worse, though, is the well-organised and well-funded Western-backed attempts to interfere with LMIC tobacco control policies, urging governments, and in some cases bribing them, to ban all safer nicotine products. A key weapon in the armoury is the promulgation, especially through reports and papers presented to the Framework Convention Conference of the Parties, a promulgation of a disgraceful and distortion of evidence based on demonstrably flawed science. In the face of failing traditional policies and the growing evidence in favour of tobacco harm reduction, the WHO, the FCTC Secretariat and NGO allies, backed by millions of Bloomberg dollars, are deflecting attention by fighting the last war against the tobacco industry, alleging that the whole safer nicotine product phenomenon is just the industry up to its old tricks again. This may re-energise the tired old tobacco warriors of the 1980s and 90s and keep people in their well-paid jobs, but it is a crime against 1 billion smokers, 50% of whom are going to die. This is the tragic lesson of history, when generals and military strategists fail through ignorance or refuse through hubris to take account of changing circumstances, dig themselves ever deeper trenches, leaving those in the firing line, in the front line, to pay the price. This report contends that the international tobacco control establishment is actually out of control, that the FCTC Secretariat has been allowed to become a runaway train of misinformation and misdirection, diametrically opposed to the best interests of global public health. It is time for a course correction. It is time for those parties to the convention who fund the FCT and the conference out of taxpayers' money to take back control of the FCTC and steer away from a self-defeating prohibition program, which now has nicotine itself squarely in the crosshairs. So what does taking back control look like? Harm reduction is mentioned in Article 1D of the FCTC, covering the definition of tobacco control, but it's not clearly defined. Yet at the time of the FCTC negotiations in the early 2000s, the term was perfectly understood by the WHO and the wider global clinical and public health community as it referred to reducing the risk of contracting HIV through unprotected sex or sharing injecting equipment. Where implemented, harm reduction policies saw significant falls in rates of infection. To put it simply, harm reduction works. There now needs to be a COP working party on tobacco harm reduction to examine all, and I repeat all, the available evidence relating to safer nicotine products, not just the material pumped out by hand-picked WHO experts who studiously ignore the inconvenient evidence about the game-changing potential of safer nicotine products. The level of paranoia and secrecy which attends the Conference of the Parties itself would not be acceptable in many other international fora. Key stakeholders are deliberately excluded from COP proceedings. Now, I've watched The West Wing more than once, and as far as I can tell, the COP is not the Situation Room in the White House. And to eject stakeholders and media from the conference is an affront to the democratic process. By contrast, the forthcoming COP on climate change will admit representatives from business and industry, agriculture, labour unions, indigenous populations, environmental groups, the list goes on. The so-called justification for this totalitarian state of affairs is Article 5.3 of the Convention and its attendant guidelines. Or rather, I should say, an over-interpretation of those instruments. Neither was meant to exclude the industry, large or small, from being part of the solution. The primary intention of both was to ensure that any engagement between industry and government was open and transparent, and that industry should not be allowed to over-influence tobacco control policies. But what has happened is that the guidelines in particular have been used not only to undermine the democratic process of the COP, but has extended beyond the COP, used by the tobacco control establishment to slander, libel, exclude and threaten tobacco harm reduction activists and academics and clinicians working in support of tobacco harm reduction. The tobacco control establishment now has all the appearance of a religious cult. Secrecy, paranoia, personal attacks, and increasingly desperate distortion of the evidence as it realises that it is now on the wrong side of history. That from nowhere in 2006, there are now around 100 million global users of safer nicotine products. Life was so much simpler back in the 1980s and 90s. There were anti-smoking NGOs and the public and medical community lined up against the tobacco industry. The FCTC aimed to assist especially lower and middle income countries to develop tobacco control policies through guidance and support in a clear division between the availability of dangerous products and a government's duty to protect its citizens. Back then, no man's land didn't exist. I could say these days that the battle lines are far more blurred, but actually there shouldn't be any battle lines. In a debate about climate change, everyone is part of the solution, including oil, energy and mining companies, as well as environmental groups. What we need now is tobacco control is for all the stakeholders to have a seat at the table, including industry and consumers working together to preside over the dying embers of combustion and not allow a tobacco control theocracy to continue adding fuel to the flames of a new war against nicotine. We are experiencing tsunamis of misinformation, hurricanes of paranoia, and global storms of hot air. What we need now, in our world at least, is climate change. Thank you very much.